think with that, we'll transition into our first speaker here, who is Dianne Como. And Dianne has worked, she is the Executive Director for International Union of Health Promotion Education, IUHPE, and based in Montreal. She's worked in pan-Canadian non-governmental organizations, and specifically Investing Kids, as the Director of Research and Evaluation. And she also worked as Specialized Scientific Advisor at l'Institut National de Santé Publique du Québec. Her work has focused on health promotion initiatives targeting children and families. Since April 2018, she has been the Executive Director of IUHPE, and she holds a doctorate in developmental psychology from McGill University. And the other thing about Dianne is that she is fluently and brilliantly bilingual. So if during the question and answer period, si vous voulez poser les questions en français, c'est possible pour Dianne de répondre à votre question en français. And we have José Lapalme on the line as well, who will help us a bit with translation of responses into English. So if that's more your comfort level, then let us know. And with that, over to you, Dianne. I'm going to look at some of the comments in the box here.
Hello, everyone. Bonjour. So thank you so much for hosting this webinar. I'm very happy to be here to talk to you about our accreditation system. But first, I just wanted to say a few words about IUHPE, because I realize some of you might not know who we are as an entity. So IUHPE is a fairly ancient organization. It's 69 years old. We're celebrating our 70th anniversary next year. But for most of that time, it's been run out of Europe, out of Paris specifically. And only since November of 2017 has it been based in Canada. So our administrative offices are now at the École de Santé Publique of the University of Montreal. And that's basically where all operations for the organization are run. So, who are we? We have a mission to promote global health and well-being and contribute to achievement of equity and health between and within countries, so no less. But I do think that we're the only organization of this nature that really focuses broadly on health promotion globally. We're an independent organization, so we promote and encourage free exchange of ideas, knowledge, experiences, and develop projects at global level and also at regional levels. We are a membership-based organization, and we have different tiers of membership. So we have institutions who are members, as well as individuals. So anyone can become a member who has an interest in health promotion. And so I would encourage you to explore that if you're interested in this field. You can always write to me about details about what that entails. There's an equity sliding scale of membership fees as well for different countries and for different levels of membership. For example, if you're a student or early career professional or retired, the fees are lower. Okay, so we have some key priority areas and strategies to achieve them. So social determinants of health, health promotion systems, which is important because we're not only about educational interventions or individual behavior, but really looking at things from a systemic perspective, sustainable development, and non-communicable diseases. And so the strategies which are in the middle cover some other things that you're certainly familiar with, health and all policies, advocacy, translation of research, and lastly, this bit here, and that's what we're largely talking about today, is workforce development. So workforce development as a strategy really helps us meet our other priorities. And we support that workforce development through various initiatives. So we have training activities, we have conferences, both regionally and globally. And of course, we have our accreditation system. So I just want to give you a bit of history on that system. It was born in Europe. Everything started in 2004. But I just want to say, though, from the start, it was very outward looking. So it started out of a European initiative, but it was always very mindful of global sources and perspectives. So it was meant to be, it was meant to grow beyond those borders from the start. So over the last 16 years, there have been different steps, along the way, and the system as it exists now was really launched 4 years ago at our 22nd World Conference on Health Promotion in Brazil. So that's the iteration that I'm talking to you about. But I just wanted you to show, I just wanted to show you that this didn't come out of nowhere. There was a rather long development process and different pilot projects that were run to ensure that it was that we built something solid and credible. And more recently, and it's not included in the slide, but more recently in 2018, we did run a workshop in conjunction with Health Promotion Canada to talk about accreditation in Canada. So this has been a dialogue between our two organizations for some time. So I think it's great that we have this opportunity to present it to a broader audience today. So a bit more about the system as such. So the goal really is to promote quality assurance, competence, mobility, and health promotion practice, and education and training in health promotion globally. And we do that in two ways: by registering individual practitioners or by accrediting programs that teach health promotion. So whether it's bachelor's or master's degrees or PhD programs, it doesn't really matter. It's just academic programs that have a focus on health promotion can also apply for accreditation with us and the practitioners. So all of this is managed by my team at the International Secretariat for IUHPE. But when applicable, when there is within a given region or country a national accrediting organization that is formed, the requests for practitioner registration goes through them, and they develop their own adapted process for this. So there's a possibility of doing that. Okay. Next. And generally how it works is we've got a board of directors for the system. There's us running the operations of it, and there are committees around reviewing materials and procedures on a regular basis, as well as an assessment committee that validates and looks at the applications from program leaders and from practitioners as well. Okay, and these are the competencies that the system is built on. So I wanted to show them. Hold on. Yes, so again, this goes beyond health education. It really recognizes the importance of working across sectors, affecting structural change to increase equity in health, and advocate for health promoting policies, strengthening health promotion systems. There's a full document on this that describes all of these competencies in detail, and if anyone's interested, that can certainly be shared. There is much overlap with the Canadian competencies. I did want to mention that. What we don't have mentioned explicitly here is the diversity and inclusiveness competency which Health Promotion Canada has. But that competency, I think, here cuts across all of the others. So in the paragraph here at the bottom that says that the competencies can be adapted, that also speaks to that. We're mindful of different contexts in developing this, and that the same competencies in their application will vary quite a bit across contexts. And that also includes being mindful of Indigenous perspectives of health and well-being. We have some partners in New Zealand who are looking at our competencies from that perspective and trying to see how they can be adapted or transformed to take that into account as well to a greater extent. Okay, so I told you a little bit about the what and the how, but I just wanted to say a few words about why. I see from the polling questions that most people on this webinar do think that it's interesting and important to have accreditation, but from our perspective and within our system, here are the reasons that we generally give. So basically, as a practitioner, gaining registration gives you recognition for the qualifications and experience in health promotion, and that's assessed according to high quality standards. It allows people to display their registered status to employers, perhaps provide more flexibility across roles, organizations, and so on, as these are recognized globally, these competencies. Demonstrate how you've continued to develop competencies over your practice, and the validity period is 3 years. So there's not an annual fee here, but there's an admin fee and a registration fee that's paid every 3 years. And the fees can vary across countries if your country has a national accreditation organization. We also, as I said before, accreditate programs of study or courses of study. And that basically provides guidelines and quality standards for the teaching of health promotion, with the quality assurance process for evaluating that. And so it provides graduates with required knowledge and skills for practice. It's a point of reference for employers. And the graduates from the programs are eligible automatically to register as practitioners within our system. People who don't graduate from accredited courses can also register as practitioners. The process is just a little bit different, but it's quicker, it's more automatic if you graduate from a course. And the validity period for the programs is 5 years. So the how to register is basically through your national accreditation organization, if there is one in your region or your country. If not, all registrations go directly through us. So meaning that anyone here who's currently interested in registering as a health promotion practitioner can do it, can apply. And same thing for the academic institutions, you just apply directly to us. The basic process is the same for everyone. There are different forms. There are slight adaptations, again, depending on where you are, but essentially you submit, we check for completeness, it's assessed, we validate the assessment with our assessment committee, we share the results with the applicant, we can request further clarification if needed to pass someone, and then once the registration fee is paid, the The practitioner or the institution is listed in our online global registry of accreditation, of accredited courses and registered practitioners. Okay, and I want to say a little bit more about what a national accreditation organization is, because I think, you know, part of this webinar might be the start of a broader discussion on that within Canada. So it is an organization that has been approved by IUHPE to help register the practitioners within the region. So either a country or a sub-region of a country. They manage and maintain the registration of practitioners and ensure that their names are recorded in the global register. Different types of organizations can become NAOs, so it doesn't have to, you know, it's not, there aren't very rigid criteria about that. It can be a professional association, it can be something, an accreditation organization that's already established within the country. And, you know, but it needs to be some people who are appropriate and who are representative and reflective of the health promotion context. It can also be a consortium of organizations, so 2 or 3 different organizations who may not be able to carry a system like that on their own can join forces to create an NAO. So some of the must-haves for this are basically to accept how we define health promotion, the ethical principles that are defined in our handbooks, have evidence of support from a geographic area, so not necessarily a country, but I think it's important to show that there is interest and desire in participating or engaging in a system like this. The NAO must also accept, you know, that there are criteria for registration of the practitioners and show that they're able to establish and maintain committees to run that system. So to that effect, to become an NAO, the main steps are basically to establish a committee to explore what that would look like and develop a proposal that makes sense for your country. And there's guidance available from us through our staff, through our board of directors of the system. So people who've been involved in our own initiatives since 2004 are still around and good resources to reach out to, as well as other countries who've set up NAOs or are in the process of doing that. We've had one in Estonia and the UK that are no longer functioning. We have functioning NAOs in Ireland and Australia at the moment. And we've got interest from New Zealand and Israel as well, who are in different stages of the process of creating an NAO. So there's a breadth of experience already in terms of how to set things up and what to expect and what to do, what not to do. And just I'll close off with a testimonial from one of the practitioners in our system, who just you know, says what it means to her to be part of this group, and that's really all I wanted to do as an overview. But of course, if there's anything specific that you want, I'm happy to answer questions about any of the details. And I did want to mention just quickly, just because we're still fairly new on this continent, but our organization every 3 years hosts a global conference on health promotion, and the next one actually is going to be in Montreal, so in 2022, and hopefully people will be back up and traveling by then, but if not, it will be a sort of a hybrid conference model. Yes. So I just wanted to mention that, just because I think it's something to look forward to in the health promotion field here in Canada. Thank you so much, everyone, for your attention.